When drinking warm milk or counting sheep no longer help you fall asleep or get that good night's rest, it may be time to turn to Henry County Medical Center's Sleep Disorders Center, a comprehensive program designed for the diagnosis and treatment of sleep disorders. An estimated 40 million Americans are living a true nightmare, suffering from chronic disorders of sleep and wakefulness. Unfortunately, many of these conditions are never identified or treated. At HCMC SDC, we want to help change that.
Primarily, our main focus is obstructive sleep apnea, or OSA. It means that the patients struggle and stop breathing during the sleep cycles, which awakens them during the night, interrupting their REM stages of sleep. Very important to get your REM stage of sleep. During REM stage, you're the closest to death your body will become while you're alive. That's the recycle stage in which the body rebuilds itself for the next day.
Once the patient comes to the sleep lab, they'll be taken to their room, familiarized with everything in the room. They'll be shown a little informational video which explains step by step what we're going to be doing that evening. Afterwards, we'll get them something to drink, let them relax a little while we put our information in the computers, and then later we will hook up, give them time to relax before bedtime so they'll be ready to get a good night's sleep.
During the actual sleep study itself, we are testing for the number of events in which you struggle to breathe, which is called a hypopnea, and also the obstructive apneic events, which is when you actually stop breathing. We have had some individuals stop breathing for close to 90 seconds. That's what actually wakes you up. Your body thinks you're dying because your oxygen levels are so low. That interrupts your sleep and wakes you up. You wake up enough to breathe to get your oxygen level back to normal. Then you go back to sleep, do this process all night long, awake, sleep, wake up, go back to sleep. Therefore, you're never rested the next morning.
We're monitoring 19 different channels. We have the EEG leads, which actually are looking for seizure disorders. We use them to see also if the patient is awake, if they're asleep, and if they are asleep, what stage of sleep they're in. We also use the leads to tell if they're dreaming or not. We're watching their chin movement to see if they do grind their teeth in their sleep. We're watching their heart to see if there are any abnormalities there, whether or not they're snoring, whether or not they're having periodic leg movements of sleep, and we're monitoring their airflow, chest, and abdominal movements.
Our physician, Dr. John Tooman, is a board-certified sleep specialist associated with St. Thomas in Nashville. He interprets the study, and upon his recommendations, he may recommend for a low apnea-hypopnea index to have an oral appliance, which adjusts the jaw outward to prevent your airway from collapsing during sleep. Anything greater than a 15, you're going to have an order for a CPAP titration study, which stands for Continuous Positive Airway Pressure Device, in which the patient wears a mask. The pressure is titrated to provide a positive pressure to the upper airway to hold it open during sleep so they don't have obstructive events.
If someone truly does have sleep apnea, it makes a world of difference in their lives. How from going from being sleepy during the day to being able to do activities they haven't done in a long time. And they are really grateful about how it has improved their lives. It can really make a difference.
Do you want to wake up refreshed and well-rested every day? Considering we spend nearly 1/3 of our lifetime asleep, it's very important to solve any sleep issues you may be having. Sleep disorders can affect all aspects of your health, including weight gain, heart issues, and more. HCMC has recently expanded our full-service facility, providing diagnosis and treatment of more than 80 different types of sleep disorders. The HCMC Sleep Disorders Center wants to take care of you. Call us today and leave the rest to us.